To keep your diabetic pet happy and healthy, giving insulin injections will become an important part of your daily routine.
Insulin administration is an important piece of your pet's diabetes treatment and is just another way to show how much you care.
Initially, giving your pet an insulin injection may seem intimidating or overwhelming, but over time the process will become just another part of your day. This short video will walk you through each step of the administration process. Your veterinary team will be able to give you advice specific to your pet's needs. Let's get started. Unless otherwise directed by your veterinarian, feed your pet before giving insulin. Take your pet's insulin out of the refrigerator and prepare it according to your veterinarian's instructions. Some types of insulin should be rolled between your hands to gently mix it, while another type must be shaken until it appears milky. Clean the rubber stopper by wiping it with rubbing alcohol. It's very important to make sure you're giving the correct amount of insulin with the correct syringe. Your veterinarian will let you know how many units of insulin your pet should receive and which type of syringe to use. While many people aren't comfortable around needles and syringes, remember that insulin needles are very small and very sharp, so your pet will barely feel the injection. Never change your pet's insulin dose or the type of syringe without speaking with your veterinary team. To prepare the syringe, first remove the cap. Draw up air into the syringe to the number of units your pet will receive. We will use 5 units as an example. Inject the air into the insulin bottle. This helps keep the pressure in the bottle stable over time. Turn the insulin bottle upside down, making sure the tip of the needle is covered by liquid. This ensures that once you start pulling back on the plunger, you're drawing up liquid, not just air. Draw up the prescribed amount of insulin, in our case, 5 units. Now, it's time to find our patient and give them some TLC. You may need help from another person to keep your pet still, but some will stand quietly if distracted with low-carbohydrate treats. Find a good location for the injection that works for you and your pet. Many pets tolerate injections well when given about 1 to 2 inches from the middle of the back, near the shoulder blade, or the hip bone. Be sure to alternate the location each time to avoid soreness. Pinch a fold of skin into a tent and gently insert the needle into the center of the fold. For safety and to keep from losing any of your pet's dose, do not place your finger on the plunger until the needle is in the skin. Once the needle is through the skin, draw back the plunger. If you see blood enter the syringe, you're in a blood vessel. Pull the needle out and try another location. If you do not see blood enter the syringe, gently push the plunger all the way down until the full dose has been given. Remove the needle from the skin.
Run your hand over the injection site to feel for moisture. This could mean the insulin wasn't correctly injected under the skin. Call your veterinarian if this occurs.
Safely dispose of the needle and syringe in a closed sharps container. Talk to your veterinarian if you need one. Now celebrate, you did it! Diabetes management is a journey, filled with ups and downs, and your veterinary team will be beside you to make your pet's future as bright as it can be.